bring on for the full billing, the headliner, Superintendent Jon Fernandez. Good morning, John.
Today, Bree and Chris and everybody, Jason, everybody over there. Thanks for the opportunity for an update. I'd like to start off, if I could, on a non-COVID subject. I just want to congratulate, if I could, the 4 of our employees who were, on that list of the AGA's top 40 under 50, top 50 under 40.
Yeah.
So I want to congratulate, give a shout out to Joy Bulatow from our internal audit office, Justin Castro from our business office, Chloe Didasco, who was a teacher last year. She's actually off pursuing her doctorate in Washington, but she was nominated as a teacher, and so congratulations to those 3. And then I wanted to congratulate one of the KOAM alums who is now working for DOE, Miss Isa Baza. So congratulations to all 4 of them. Again, top 40 under 50, and I'm actively lobbying for them to do to actually do the top 40 under 50 so we can qualify for those of us who missed that 40 mark. I ask that you join me in that petition. I also wanted to just also announce something that may have slipped under the radar for many. Again, a non-COVID related item, but it's something that we worked very hard on over the last 3 years to win a grant from US DOE, which is about a little over $3 million grant to set up what we call a state longitudinal data system. And really what it is, it's a database that tracks our students from the minute they enter our school system in pre-kindergarten all the way until they finish up at GCC or UOG. So it's a partnership with the university and the community college to really give us data as to whether our students are on track for college level work and whether they successfully complete that work. Right now, we have a lot of these conversations and we make a lot of assumptions about what happens to our students, but we really have no way of tracking the success of our students once they leave our hall. So that's a very important project for us that will yield a lot of data that we will be able to share with between our university, community college, and DOE, as well as with our policymakers, really kind of honing in on the strategies that are working and looking at how we can invest in the success of our kids. So I wanted to thank UOG, Dr. Kreis and Dr. Okada for joining me last Friday in kicking off this initiative. It'll be a couple years to get the system up and running, but I've seen what happens in other states. The data that's produced really is important, not just for education, but for the workforce. And so we look forward, once we're out of COVID-19, hopefully, to being able to kind of talk more about this with our partners in the community. But getting back to what we're dealing with and where we are today with our COVID-19 response, I want to thank our mayors and our nonprofit organizations for doing such a tremendous job with our food commodities distribution. I think, as you know, we went through the summer. We had some traffic issues and distribution issues and very long lines, in a couple of areas around the island, once or twice a week. Now we're working directly with the mayors on a rotating schedule to give them commodities that they can push out into their villages and to ensure that they're getting to our elderly citizens, to our families, our individual disabilities, and then to those who are in need. And that really has worked very smoothly. The mayors actually get the commodities and they schedule and get the word out to their community residents regarding the commodity distribution. Some of it's drive-through, some of it is actually door-to-door delivery to those who need it. And then, of course, we have our nonprofit organizations that also assist us. So today, I believe they're going to be in Santa Rita giving out commodities. I think on the 29th, it'll be at Umatic doing door-to-door. And then the 29th will be Maritzo. We're also going to be working with the Santa Barbara Catholic Church Food Pantry to provide them food commodities as well. So I want to thank all of our partners. It's really relieved the burden on our staff while continuing to facilitate food out into the community. I also know that for our families who are taking advantage of our school lunch program, our breakfast and lunch program, to date, we've really been focused on getting out a lot of our breakfast items because that was really what we had in stock, and we've been pushing them out every Friday. On the 13th, we will be getting additional food lunch items that will now be added to the food supplies that are going to be provided every Friday. So the families don't need to worry about it. It's going to be the same drill. They'll be able to go to their school nearby, Again, from the hours that I believe it's from 9 to 12. But instead of getting just some of those breakfast food items, they will be getting other food that will constitute the lunch portion of it. So we're very glad to be able to make that happen. So we welcome our families coming to our schools for that kind of support. Other than that, yeah, I think as we talked about last week, we are gearing up for much more visible and inclusive discussion about reopening. So we watched. I've seen Dodea buses already, mobilized this week. We definitely are looking forward to them having a very safe and smooth reopening. Of course, we wish them the success, and we hope to learn a lot from their experience. So, we see that happening on our side. We're letting our stakeholders know that we will not be opening for face-to-face learning, but we are looking at the possible opening in January. So we've been working hard. Every Friday, we'll be briefing the board and putting out information to the community regarding where we are in that process. As part of that, we will be releasing our school reopening dashboard probably every Thursday afternoon, so that on Friday we can discuss it with the board. That'll give the community a better sense of how we are measuring and assessing our risk levels for returning. We also will be engaging, I believe we'll be doing 3 very important surveys leading into the potential reopening in January. So we have teams that are putting those surveys together because we do want the input from our parents, our students, and teachers. So we believe there'll be one in November, early December, and then one prior to the opening target date in January. Of course, none of this can happen while we are in a serious public health emergency. So, again, this is all dependent on the governor and public health announcing that we're safe to at least begin reopening. But when that happens, we will definitely be ready to go. So with that, let me go ahead and stop there, and I'm happy to answer any questions that we might be getting from the community.
Yeah, let's follow up on the lunch items. You said November 13th. Is that for 5 days? Are they hot meals?
Yeah, they will be non-perishable food items, but they will be the equivalent of 5. They will be the equivalent of 5 meals so for every student. They should be able to get the equivalent of 5 breakfast meals and 5 lunch meals.
And the education reopening dashboard, you said Thursdays. Is it this Thursday you're going to start it, or next Thursday?
Yes, we'll put out we're working on updating the version that we have, but we do want something out this Thursday. And then what we'll do is, based on that, we want that to use that as well for our board discussions. So that'll be a weekly update. So for those who are paying attention to the numbers and want to see how we're looking at those numbers as well, we want that to be a basis for our discussion. I mean, right now, as you know, Bree, with the numbers that we're looking at, we're hovering around 700 new cases over a 14-day period, just these last 2 weeks. And the target to get into low risk is to have less than 20. So we're really much higher than we need to be on that metric. And then as far as the positivity rate goes, again, to get to a low into the lower range of risk, we got to get below 5%, and we're hovering around 13 to 14% over the last 14 days. So a lot of work to do on the public health side. We have our nurses, the nurses and social workers out there helping with our frontliners at public health. And then I'm actively, working with the governor, lieutenant governor, regarding some of the other issues that they're facing. And we know one of those issues really has been the capacity of the hospital for dealing with, the cases that they're seeing. So in the pandemic plan, there is the potential use of school facilities and so forth as part of that effort. We're not there yet, and the governor has made it very clear that that's not her preference. But of course, we know we have to also be aware of the realities of our situation and plan accordingly. So we want to just thank the governor, lieutenant governor, for just keeping us updated on that front. And we're here to be partners with the community and trying to get the situation under control.
Mm-hmm. The pandemic plan that you're referring to, does it say what schools?
Well, early on there was an assessment of Ukuru and JFK as part of that preparation, but the governor has been very hesitant and very reluctant to use school facilities, and we thank her for that. But we also know that should the situation get worse, which we hope it won't, we want to make sure that she knows that we're here to support the community and the community's public health efforts.
We did get a release from GDOE, the IEP virtual meetings that you're going to be having. You want to talk
Yeah,
about that?
so yeah, special education has been a really tough area to address during COVID-19. So we do have a lot of supports that are here and underway in terms of trying to help us adjust to the current situation. So as part of our efforts to really reach out to parents and ensure we're addressing their needs and their concerns, there is a 3-part series that's focused really on the IEP process. Again, the IEP process is not a new part of the process. It's just that during this COVID-19 situation, our parents and our students and our teams at the schools have had to come up with interim plans to make sure that services can be considered and delivered within this COVID-19 shutdown. Otherwise, that the IEPs typically govern the services that can be provided at the schools, in the school setting. So it'll be a much more interesting conversation than maybe in prior years to determine exactly how to construct the IEP so that we can get through what might be a prolonged shutdown, and then and what happens when we return to normal. So that'll be the opportunity for our parents to come engage in those updates.
John, where are we with the number of GDOE employees that have tested positive? I know
I don't have the exact number, but I know we're around 80 as of this week. So like I said before, 80 employees. Some of them haven't been on campus for several weeks, so it really is not maybe a major concern for the campuses themselves. If they have been on campus, of course, we go through a very strict cleaning and disinfecting protocol. But some of them are just getting it through contact tracing through what's happening out in the community. So we're monitoring it. We're up to 80 at this point. And of course, it always raises concerns within our GDOE family for the health and well-being of our employees. Again, and we're also tracking the number of school-age children. Again, as you know, those numbers since September 1st have grown 4 or 5 times where we were on September 1st. Versus, I think the overall population is kind of growing at maybe at a rate slightly slower than that. So with all the household spread and the community spread of COVID-19, we're now starting to see a lot of that impact our school-age kids. So we're monitoring that and working with the governor's office to try to get more data on how the kids are impacted. I think the research has shown that we're really not necessarily concerned about the children getting the most major symptoms that are associated with COVID-19. What we're seeing is that they might be less affected if they are positive, but of course, they're in an environment where we have many adults, many of them who may fall into the high-risk categories. And so when we monitor for how it's affecting our kids, we're really talking about what happens if they come back face-to-face and, the adults are come up testing positive because of the spread within a school. So those are one of the issues that we'll be considering as we look through our reopening plans.
Right. Before we let you go, I wanted to follow up on some discussions that you guys had a couple of weeks ago about the Education Supervisory Financial Commission, something like that, and right. Requesting an opinion, I believe, from the Attorney General's office, because there's some overlapping responsibilities with the GEB and this commission.
Right. So the board has asked us to seek an attorney general's opinion, and I don't believe we have that back yet. But in our discussion with the attorney general, it did seem that there was language in the statute that probably needed to be clarified by the legislature, because there were sections that looked like there might be overlapping duties and responsibilities within this commission and with the board. So it's really important that we work through that and try to figure out, what that clarification will be, because we need to know who's in charge of the certain aspects of the educational system. I think in the past, the EFSC has really been much more constrained in how they've exercised the authority. But it was recently brought up that there are these other powers that exist. I believe that those powers were intended should the department go into some kind of, real serious situation where we're unable to complete our duties. But again, it doesn't seem to distinguish between where the commission's duties end and where the board's begins. And that's the issue that still needs to be cleared up. We haven't really focused on on some of those disagreements the last couple of months. Things have been pretty smooth as we transition to the new fiscal year, but it is something that's still outstanding.
Okay, so no Attorney General opinion yet.
I don't believe so. Let me double check my lawyers, but I don't believe we received it yet. But I know that our preliminary conversation was really an agreement that there did seem to be language that the legislature probably might want to, really clarify to make sure there isn't any confusion.
All right. Well, thank you, John. Always
Right,
good to hear from you.
Right on. Appreciate it, John. Grab some virtual carne asada. That's Jason's recipe, not Jay.
Yeah.
No, I had it on the way in. So
Might be slightly burnt around the edges because
That's caramelized. It's not burnt.
Yeah.
Thanks, guys.
Thank you, John. Appreciate it. 8:42.
Jason cooking. No, it's more
just
like he
doesn't-
put it in the microwave.
Two words that don't go together. Jason cooking.
Hey, there's not a computer on earth I can't make talk to me, but when it comes to
Oh
the
my
microwave, that's not my.
You make a pretty mean hot pocket though.
I can do that, or honeycomb, dude.
You and Andy, your hot pocket. That's like it's 8:42. We got to take a break, guys. I know. Oh, that was tiring. So we'll be back, and we're gonna throw it over to our KUM News sports director, and talk about sports. There's a word you haven't heard.
Yeah, that ball that you kind of.
Yeah, there was. So what we have in here, there's a guy who used to do a lot of things with the one game, something like a national pastime with the